Welcome to this month's CNA in-service for February 2026. This month is entitled Understanding a Person with Dementia, or PWD. The goal is to understand what dementia is and how it affects an individual. We will look into the changes and types of dementia, as what staff can do in response to, or how to care for and pay attention to someone experiencing the effects of dementia. So let's get started. Your brain is like a computer. It is responsible for everything you are experiencing, externally and internally. There is nothing you are able to do without the brain being involved in some way. Let's look at some of the general areas of the brain and what it is responsible for. The red area that you see in this picture is called the frontal lobe. The personality, emotions, and arousal, intelligence, ability to concentrate, make decisions, plans, but put things in order, solve problems. It's also responsible for awareness of what is around you, voluntary movement, ability to speak and write, and behavior control. In the yellow area, this is known as the parietal lobe. These are responsible for your sensations such as pain, touch, temperature, understanding and interpreting sensory information such as size, color, and shape. It's also responsible for understanding space and distance and math calculations. In the blue area, the back part of the brain is called the occipital lobe. This is responsible for vision, interpreting what you see. Then you have the cerebellum, which is underneath the brain. This is usually referred to as the little brain. It's responsible for balance, motor, movement, coordination, posture, and fine motor skills. Then you have the brainstem. The brainstem is responsible for breathing, heart rate control, consciousness, alertness, wakefulness, swallowing, blood pressure, sweating, basically all of the things that you don't have to concentrate on. And then in the purple area, this is known as the temporal lobe. This area is responsible for the ability to understand language, hearing, memory, long-term storage of memories, organization and planning, and behavior and emotions. Now, let's imagine that our brains have been affected by dementia. What happens to those areas that are responsible for our everyday living? Dementia leads to loss of neurons and synapses, particularly in areas involved in memory, learning, and reasoning such as the hippocampus and cerebral cortex. That is pictured on the left side of the page. As neurons degenerate, the brain shrinks in size and weight over time. This process is called brain atrophy. That is pictured below on the right-hand side. So you can see the difference in the shape and size of the brain from normal to the one that's affected by dementia. So what is dementia? Dementia is a syndrome characterized by a decline in cognitive functions, including memory, thinking, reasoning, and behavior, that is severe enough to interfere with daily life. It is not a normal part of aging. Dementia isn't one specific disease. Several diseases can cause dementia. As we've previously noted, the effects of dementia can cause cognitive and psychological changes. So let's look at some common changes in behaviors. So the cognitive changes, you might see memory loss, which is usually noticed by someone else, problems communicating or finding words, trouble with visual and spatial abilities such as getting lost while driving, problems with reasoning or problem solving, trouble performing complex tasks, trouble with planning and organizing, poor coordination and control of movements, confusion and disorientation. Some psychological changes could be personality changes, depression, anxiety, agitation, behavior that doesn't fit the situation, being suspicious, known as paranoia, seeing things that aren't there, those are known as hallucinations. So now that you have the basic concept of what dementia is, let's look at the different types. The number one most common diagnosis is called Alzheimer's disease. This affects anywhere from 50 to 75% of people with dementia. Difficulty remembering recent events, names, or conversations are early symptoms. Later symptoms include impaired communication, poor judgment, disorientation, confusion, behavior changes, difficulty speaking, swallowing, and walking. The lifespan of someone with Alzheimer's disease is anywhere from 8 to 12 years. Another type of dementia is called frontal temporal lobe dementia. This affects up to 15% of the cases. Changes in personality, behavior, and difficulty with language. Behavior can be impulsive and challenging. They tend to drink lots of fluid. Loss of inhibition, so this means that whatever they're thinking is going to come right out of their mouth. So they could make rude or mean statements to others. They have OCD behaviors a lot of times. Usually diagnosed at around 60 years old, but they can live a few years longer than those diagnosed with Alzheimer's. Another form of dementia is known as Lewy bodies. This is usually number 3, and it affects up to 25% of the cases. This can be easily misdiagnosed. Early symptoms are very similar to Alzheimer's. Other early symptoms include disturbances, visual hallucinations, so they can maybe see animals, children, or people. Muscle rigidity is another common symptom. They have gait disturbances. A lot of times they may gait to the left. Unable to distinguish dreams from reality. They are usually a fall risk. Their abilities can fluctuate. They live anywhere from 7 to 9 years after diagnosis, and usually diagnosed in people younger than 60 years of age. So let's look at how dementia impacts communication. One of the biggest factors our residents are faced with is how they communicate with us when dementia starts to play a role. These are just a few categories, but they are the most commonly recognized. One of the first signs of dementia is the inability to form a complete sentence or word-finding difficulty. Nouns are usually the first thing a person with dementia loses, so trying to describe an object or explain something will be more challenging. Short attention span. Don't expect to hold a person with dementia's attention for very long. Most of the time, they are not focused on any one particular thing. They are easily distracted by what they see or hear and continue this pattern throughout the day. Remember, since they aren't able to carry on a conversation at this point, so keep your words and your thoughts short and simple. Reverts to native language. Since the part of the brain that processes short-term memory is not functioning like it should, they rely on what they remember with their long-term memory. They may even go back to speaking their native language as a child because that is all they remember speaking. Becomes quiet or speaks less often. There are also some that feel embarrassed or too frustrated when trying to communicate their needs, so they stop speaking altogether. Give the resident a longer time to process. When the brain is dying, the time it takes to process information slows dramatically. Therefore, we need to learn how to slow down and wait for a response when we communicate with someone who has dementia. General rule of thumb is to give the person about 60 seconds to process what is being said. When a resident loses their understanding or ability to express thoughts, they may feel irritated, angry, frustrated, or confused because they are no longer able to express thoughts or understand simple instructions or tasks. When this happens, we need to change the way we respond or find alternatives that may better serve our residents. You may have noticed that some residents begin to have short-term memory or repeat conversations quite often. We need to respond as positively as we can and treat the situation as if it's the first time you have heard it, and validate any concerns as if it's the first time. Remember, they do not remember already having said that. Loss of reality is another way dementia impacts communication. When communicating with someone who has dementia, you may have noticed that the person says that they have talked to someone who isn't there, or maybe they have had a conversation with a loved one that has already passed. Sometimes they will tell you something happened yesterday, and it may have happened 10 years ago. Do not argue with them and say that it didn't happen or their loved one is no longer living. In their mind, that is their reality. You may instead ask them something like, "Tell me about your husband," or "What do you love about that person, place, or thing?" Reminiscing with them is much better than trying to argue with them, and the chances of a behavior happening is less likely to happen. The last example is reverts to nonverbal language. If the frontal temporal lobe of the brain has been affected, you may have noticed that they can no longer form sentences or talk about a subject matter. The late stages of Alzheimer's disease, sometimes referred to as severe Alzheimer's, may last from several weeks to several years. As the disease advances, the person with Alzheimer's may rely on nonverbal communication, such as facial expressions or vocal sounds. If you notice any of these patterns of behavior or reactions that are not considered normal, you need to fill out an observation report and notify the nurse. Constipation, physical discomfort may be a trigger for behavior. Medication reaction, sadness, depression, anxiousness, fear, confusion. Maybe they're hungry or thirsty. Pain or illness, fatigue, hearing or vision loss. All of these things can trigger behavior. So there are some environmental triggers that we need to be made aware of. There are some factors that can affect our individuals with dementia that we may not pay much attention to from day to day. Some of those are the same kinds of things that our clients are fully being challenged with. For instance, if we are uncomfortable because the room is too hot or too cold, we change the way we dress. But our clients do not, and they rely on us to notice this. They can suffer from health issues such as hypothermia or hypothermia as a result. Transfer trauma refers to a complete change of environment from home life to living with multiple individuals who are mentally disabled or living with psychological problems. This can also force them to give up their normal routine. Until they adjust to this new living environment, there will be some challenges along the way. Some of our individuals need stimulation or prompting to help them with daily skills or routines. Others may be overstimulated because there are too many individuals around, too noisy, or disorganization creating an excessive stimulation. Even the lighting in the houses can bother an individual that is easily overstimulated. Our residents observe our own behaviors more than we realize. They sense our emotions and they will react to them. So we need to be careful how we approach our residents and ensure that they are safe and their needs are met in the best way possible. Some of the caregiver approaches that can trigger dementia behaviors are rushing through care or not a lot of interaction, demanding or ordering, ignoring them, scolding or reprimanding them, displaying anger, frustration, stress, or displeasure, not offering choices, communication breakdown, not honoring past preferences, reality orientation, trying to reason with, or arguing. These are all just a few examples. Just remember that dementia isn't the person. It's a progressive deterioration of the brain. What remains of the person, their emotions, abilities, or independence, is where our focus of who they are should be. So remember, the person with dementia is a person first. They still have needs, they still have love, they still have affection, they have preferences, they have interests, they still experience fear, they have feelings, they like routines. They just need to be able to express themselves. It's important to be empathetic when caring for our residents, so put yourself in their shoes. Ask yourself, how would I feel in this situation? What would I do if I was in the same situation? How would I want to be treated? What can I do to make the situation better for the person with dementia? So there are a few givens to remember about individuals with dementia. Behavior is a method of communication. They're not behaving like this on purpose. They're doing the best they can. When approached, a person's automatic reaction and instinct in the face of fear, confrontation, and similar situations is to fight, flight, or freeze. Be in the moment with the person with dementia. Try not to take offense. Come back and try later as needed. Proactively or in a timely manner, address physical needs. And here are a few more to remember. Always reassure. You cannot reassure them enough. Let them know you are there to help. Validate and support their feelings and then redirect. Don't argue with or try to reason with. Tell them what you're going to do before you do it. Use their name often. Use nonverbal communication positively. Break down tasks and speech. Keep it simple. and reminisce with them. Knowledge is power, so make sure you have knowledge of the person's history, which includes such things as their past routines, their likes, dislikes, past work, what makes them happy, what makes them sad, what's their passions. Identify communication methods. Know what the tells are that you can recognize when they need to go to the bathroom or they're hungry. Identify past trauma. If they're having catastrophic reactions to something, try to investigate and figure out what the underlying cause of that is. Work with family to create an optimal environment and emotional support. Being able to read someone's body language is more instinctive than you realize. We pick up on subtle or not so subtle signals that indicate how the person is feeling, not just what they are saying. So be alert to your body language as you interact with the person with dementia. Is it positive or negative? Is it threatening or non-threatening? Is it caring and supportive or cold? Is it pleasant or unpleasant? Is it showing interest or disinterest? Is it accepting or rejecting? Are you in a hurry or in the moment? Be alert to the person with dementia's body language. Do they understand or are they confused? Are they happy? Are they sad, upset, anxious? Are they fearful? Are they engaged? Are they percolating a behavior? Be alert to a person with dementia's body language and unique tells. So a smile can mean happiness, relaxed. A frown or slightly turned down mouth could mean confused, unhappiness, disapproval, or constipation. Rapid eye blinking or frequently looking away could be distracted or uncomfortable. Lip biting could be worried, anxious, or stressed. Tight lips could mean disapproval or distrust. A clenched fist could mean anger, pain, or constipation. Fidgeting can be impatient, bored, frustrated, or anxious. A closed body language, arms tight to the body, curled into themselves, making themselves physically smaller. They could be trying to protect themselves, then maybe they feel threatened. The unique tells just simply means fiddling with, belt or pacing means I need to go to the bathroom. Rubbing my arms means it could hurt. We always want to create a positive, safe, and supportive environment. So here's just a few examples of that. Good lighting, no shadows because their vision fades. Comfortable temperature with staff and others. Provide places to be alone and places to be around others. Ensure their room is familiar, safe, it feels right, and is easy to navigate. Provide wayfinding support. Engage and appeal to multiple senses, touch, smell, vision, hearing. Make it interactive. Promote freedom of movement and independence. Decrease clutter. Think outside of the box. A person used to living near a train track may need to hear tape sounds of a train at night to sleep. A wife missing her husband may sleep better with the smell of his cologne on her pillow. You may want to consider some activities and items that can help calm individuals with behaviors from dementia. Providing pet therapy or stuffed or robotic animals can help. Any aromatherapy, lavender, favorite scents or lotions, etc. Favorite music, fidget toys or items to work with their hands, a rocking chair, lifelike doll, different types of soft fabrics, a weighted lap blanket, streamed images of animals, children, calm scenes and sounds, a soft lap blanket of different textures. So to teach staff stress management techniques, these are just a few things that you could do during the day when you're feeling overloaded with stress. One of the things you could try is deep breathing techniques. This helps lower blood pressure or stress levels, and it's scientifically proven to help reduce blood pressure, lower heart rate, and anxiety levels. You can inhale for 4 seconds, hold for 7 seconds, and then exhale for 8 seconds. This technique helps activate the parasympathetic nervous system, promoting relaxation. Another way that you can help decompress is to count to 10. Helps slow down the mind, provides a brief rest, and can influence the release of neurotransmitters that promote relaxation and emotional well-being. It draws your awareness away from distracting thoughts and redirecting it towards a single manageable task. Whether you choose to count slowly from 1 to 10 repeatedly or use a specific pattern, the key is to maintain steady focus on the act of counting. The deliberate pace of counting helps reduce the chaos of racing thoughts and overstimulation. Grounding techniques. Visualize 5 things you can see, 4 things you can hear, 3 things you can feel, 2 things you can smell, and 1 thing you can taste. This helps shift your focus from anxiety to the present. And then stretching or movement. Take a few minutes to stretch or perform light movement to relieve physical tension and improve your mood. So the bottom line is have some empathy. Put yourself in their shoes. Also, make sure you provide dignity. Treat the person with dementia as you would want to be treated. Communicate. Use positive verbal communication. Pay attention to nonverbal language, yours and theirs. And slow down. Always stay calm and be patient. Thank you for participating and hopefully gaining a better insight on persons with dementia. Please make sure to take the quiz and then have them graded by your supervisor. All graded tests need to be returned to staff development no later than February 28th. Thank you.